Hello everyone, good morning. Thank you all for joining us for our healthcare breakfast this morning. I want to thank both Andy and Jadra for being here for a very informative talk, something that can help each and every one of your business. You know, it's a challenge you face each and every day, so that's why I like to host these programs. So again, I want to thank both of them for being here today. I'm going to turn over to our great speakers. They'll be here for questions and answers after as well, and I'll let them take it underway. So thank you again for joining us.
Perfect. I want to thank everyone for coming out this morning. I know it's not always easy breaking away first thing in the morning for an event. And I also know hearing about insurance or health insurance is not always the most appeasing first thing in the morning. Very important topic. I'm excited to partner with the connector for the Mass Connector for Business. Out of all the intermediaries and carriers, insurance companies we work with, our relationship with Jadra and her team at the connector is by far the best. When I talk to clients and prospective clients, the level of service, the response that we can provide to you is one of the most important aspects that we bring. And we can only respond as quickly as our partners and our carriers and our intermediaries respond. So I'm really happy to introduce to you Jadra Sanders from the Connector for Business. She will be celebrating her 5th year anniversary on Monday as the Associate Director for the Connector for Business. A couple of things that Jadra is going to highlight that are exclusive to the Connector. The first is businesses are able to offer their employees a choice in health insurance plans and insurance companies. And more as consumers and as consumer behavior changes, you know, health insurance is very near and dear to all of our lives. So having a choice and having some input into that is extremely important, exclusive to the Connector. Depending on your business size, you may qualify for the Connector's Wellness Rebate, which provides your employees $100 back for a wellness activity, but also provides a 15% rebate on the employer-paid premiums. Again, exclusive with the Connector. And then some businesses may qualify for a federal tax credit. Without further ado, I'd like to introduce to you Jadra Sanders. Jadra?
Thank you.
Would you like to be over there?
Right? Oh, thank you so much. I don't know if I ever got a hand clap, so thank you. Andy's gonna go through the PowerPoint because we brought a short HDMI cable today. So,
Real world problems.
real world problem. I don't think I really have to go over the agenda because Andy already covered it. We're going to tell you about the Health Connector and the Health Connector for Business and what it is, some of the savings, some of the exclusive options, and then we're going to tell you how to go ahead and get started for offering health insurance to your employees and yourself through your business. Go ahead. So, are you all familiar with the Health Connector? Good? All right, a little bit, okay, great. So let me just tell you about the Health Connector. So on my side, I'm running what is the Health Connector for Business, and that is the product line that allows for employers in Massachusetts that have 50 or fewer employees to buy health insurance through the state's health insurance marketplace. So we are the state marketplace. There's also opportunities on the other side, the individual and family side, for those who cannot get health insurance through a job or any other resource. And they might be able to get subsidies or assistance in getting help with their health insurance. So we have two sides. Also, I just want to let you know that I'm going to say the words health a lot today, but we also offer dental insurance. So just keep that in mind. I might not mention it much, but we do also offer dental insurance. Want to go to the next one? Now, I said the word marketplace. When I say the word marketplace, what I'm really saying is we are a one-stop shopping solution. When you come to the Health Connector for Business, you have access to buy from all the leading insurers here in Massachusetts. Now, when you look at this screen, you see a lot of logos that you might be used to. Some you might not know because they're not in this area. They might be over in Western Mass, and you know maybe you're not in Western Mass. But based on where your business is located, you will have access to the carriers that are within your area for coverage based on the zip code of your business. So I'm going to talk about Health Connector for Business today. And Andy's going to assist me with some of it too because he's the one working directly with all of you. So we've been in business for Health Connector for Business itself since 2018. So I've been with the company for 5 years, which means I've been with Health Connector for Business since it started. And what we have done year after year after year is get feedback from our employers who offer health insurance through us, and also our brokers who assist us in offering health insurance through the Health Connector for Business. And we try to find out why do people like using the Health Connector for Business. The first thing we hear is they love that we're a one-stop shopping solution. All the leading insurers in one spot on an online platform, available, look at, compare. You don't have to go from this site to another site. They're all right there. So it makes it very easy for you to look into these benefits while also taking care of things that you have to do for your regular business priorities. We have competitive premiums. So when I say competitive premiums, because you have the ability to shop across carriers, to shop across choice models, to look at everything in one spot, most businesses say that they save on average about 20% by coming to us. And that's because they're making decisions easier by just having everything available at their fingertips. And financially, that can really make it easy for individuals to compare. We also have wellness rebates. So I'm going to talk more about that, but we are going to give you money back for promoting wellness in your business place, your workplace. Employee choice model, that is what Andy mentioned right at the beginning, and that is the opportunity for you as a business owner or the decision maker within your business to create a cost control while providing your employees with options, so they can choose the one that best suits them, even if that's not the one that fits in the business's budget. We also have free certified assistants. We have over 500 people, just like Andy, on the Health Connector for Business, who are individual brokers within the communities across Massachusetts that are available to assist any business with Health Connector for Business related items for free. They will not charge you for any Health Connector for Business related consultation. And also, when you are offering a plan through the Health Connector for Business, you can have peace of mind that you are offering a plan that has passed our seal of approval and also meets minimum credible coverage. So it covers all the 10 essential benefits, and your employees will not get any tax penalty or anything. They meet minimum requirements for state and federal law. Should I go to the next one? So there are some great highlights of offering options through the Health Connector for Business. One is you might have something else in place called a health savings account plan, another extra benefit. On the Health Connector for Business, all of the carriers offer at least a silver level, that's a benefit tier, health savings account compatible plan. So you can have both of them. You can have this health savings account benefit, and then the employees can enroll in a plan that is compatible with the health savings account benefit. We also have PPOs. So if you have employees who might not be in the immediate area, you know, a lot of people are working remote now, and they might need access to health insurance to cover them in another area, they can enroll in a PPO. We have those available also. And I already spoke about the minimum credible coverage, but I just like to repeat it again. You can feel safe that you are offering a plan that meets state and federal minimum credible coverage. Can you go to the next one? All right. So this is the part we really like to talk about, employee choice models. And we're going to share this part of the presentation. So the employee choice models are unique to the Health Connector for Business. You cannot find this way of offering health insurance anywhere else in Massachusetts. And the key is
Repeat that one, I think it's very important.
That you cannot find this anywhere else? Okay. So yes, the employee choice models, they are an exclusive way of offering health insurance in Massachusetts, and they are only available through the Health Connector for Business. And what the goal of the employee choice model is to allow for an employer to create a budget, a benchmark plan, a base plan. I mean, you'll hear all types of things, but what the business can afford to pay into, but then releasing the choice to their employees for them to enroll in the plan that best suits their needs and their family's needs. Because we're all here together right now, and I will tell you that none of us probably have the same medical needs. So probably within your business, your employees do not have the same medical needs either. So this will allow them to choose a plan that best suits their needs, and for you to be able to set a budget that fits in your plan for the year for your business. So these are called one plan, one carrier, one level. I have this written up here. It's very health insurance speak. I don't go too much into this grid. I'd rather just go to the next slide, and I'm going to talk about pizza. I know we're in a restaurant, we're having breakfast. Maybe I should have talked about eggs, but I'm going to talk about pizza, all right? So let's imagine health insurance is pizza. And I'm going to explain what one plan, one carrier, and one level is in comparison to pizza. So imagine you say to your employees, you're going to get a pizza, we're going to share the cost of it. So your employee is going to get this whole pie, but the business is going to share the cost of this pie with the employee. Now, you as a decision maker in a one plan option, you say to your employees, you are going to get a pepperoni pizza from the pizzeria, maybe down the block, and the business is going to pay for half of it, and you're going to pay for half of it. That's how one plan works, and that's pretty much the decision maker telling the employee what they have access to. And if they want that pizza, or if they need that pizza, let's pretend it's health insurance, if they need that pizza, they're going to go ahead and buy that pepperoni pizza from the pizzeria down the block, and they're going to pay for half, and you're going to pay for half. Can you show that in health insurance? All right, so that's what it kind of looks like when we're comparing it to health insurance. What you're saying is you're saying, I'm going to offer you this plan from this carrier, we're going to pay a portion of it, and you'll pay a portion of it. If the employees need the health insurance, they'll enroll in it, and then you'll take the other portion out of their payroll. If they don't, they'll waive because they have health insurance elsewhere. I want to let you know that this is not exclusive to the Health Connector for Business. This is offered elsewhere, but because it is the traditional way of offering health insurance in Massachusetts, we also have it available on our platform. Let's talk about something exclusive to us, one carrier. So let's imagine you say to your employees, we're going to share the cost of a pizza. You get the pizza. Here's the deal. You can get a pizza from the pizzeria down the block. You just chose the pizzeria. We looked at the menu. The business can afford to pay into the pepperoni pizza. We can afford to pay for half of the pepperoni pizza. So you've got, how much is the pepperoni pizza? $10? You've got $5 to spend towards any pizza you want. It just has to come from that pizzeria. So the employee's still getting the pizza. The only thing is they have to get it from the pizzeria down the block. You've given them, in this case, $5 towards that pizza. You might have someone who's, I don't like anything on my pizza. They might get a cheese pizza. That cheese pizza might only cost $8. You've already allotted $5 to them, so they'll pay out of their payroll $3 for the cheese pizza. Somebody might want a Supreme. It might be $15. So in that case, you allotted $5 to them. They'll pay the other $10 out of their payroll, or they might just get the pepperoni pizza and pay the other $5. So how does that look with health insurance? You choose the carrier as the decision maker. You choose a plan from that carrier that the business can afford to pay into, and then the employees can buy the benefit tier that best suits their needs. And when I talk about benefit tiers, the higher the metal, the less out-of-pocket cost when you go see for the doctor for services, but the higher the premium. So if someone needs more coverage, maybe they have something coming up, medical issues, or they know that they have, routine visit, they might buy a little higher on the metal tier so that they pay less out-of-pocket when they see the doctor. Or they might buy down because they don't need that high of a comprehensive coverage. They get to make the decision, and the business gets to pay into the plan that the business can afford. Next. So that's kind of what we compare it to. So say right now you're offering health insurance, and maybe you're paying into a comprehensive, very comprehensive plan. Maybe it's costing you guys $1,000. But not everyone needs that comprehensive plan. Through the one carrier, what the business can do is pay into the less comprehensive plan for $700, and then allow their employees to buy from that carrier wherever they want. But the business will only be responsible for the plan that they pay into. Okay, next. How does one level work? So one level, we're still buying a pizza, and the employee's still getting it. In this case, you tell your employees, you get the opportunity to get a pepperoni pizza. So you just chose the pizza that they get. You look at all the pizzerias in the neighborhood, and then you say, we can afford to pay into the pepperoni pizza from the pizzeria down the block. Now, your employees might not like that pizzeria. So they don't have to buy the pepperoni pizza from there. They can look at all the available pizzerias, take your $5, and buy the pepperoni pizza from the pizzeria of their choice that's available to them. And obviously we know when we go to different pizzerias, pizzas are different prices. They will pay the difference outside the money that you allotted them, the $5 in this case. And so let's take a look at that. In this case, this is what it would look like with health insurance. You choose the metallic tier, so you're controlling the out-of-pocket costs when they see the doctor for their services. Then you're paying into a carrier that the business can afford. But carriers have different provider networks. So not all carriers have doctors that your employees might need. In this case, they can buy across these carriers at this metallic tier and choose the one that has their doctor in the network, even if the doctor isn't in the network of the one that you're paying into. So you allow for your employees to keep their doctors. And that's kind of what it looks like when you're thinking about maybe if you're already offering something. Maybe you're paying into a very large network plan right now because you want to make sure all hospitals are covered, all doctors are covered. You don't want to play a guessing game with your employees. And maybe that's costing you about $1,000 right now. Well, you have the opportunity to lower your budget by paying into maybe a slightly narrower network, and your employees still have access to all the carriers. So you're only going to pay into the one that the business can afford, and then your employees can buy across those carriers and choose the one that has their doctor in the network. Andy, I'm going to turn it over to you to give some real-life situations.
Yeah. So what does this mean to your business and the health insurance and the benefit plan that you put together for your employees? How do we transfer from pizzas to insurance? I'm going to give you 3 examples of each. The first is going to be the one plan. This is where Chaitra mentioned you choose the pizzeria and you choose the pizza. In this example, we had a client come to us a couple of years ago, a landscape company in Peabody, Massachusetts. They had 3 employees. All 3 employees are enrolled on the plan. This company was currently a connector for business client, but not working with a broker. The owner had kind of done it on his own and had selected a carrier that has a regional or nationwide network. Now, when we talk about what goes into the premiums for health insurance, there are 3 primary factors. One, of course, is age, either the employee's age or the average age of the group, depending on which way we're doing it. The second is obviously the benefit level. How much does the plan pay? Does it have a low deductible, high deductible, low out-of-pocket co-pays, high out-of-pocket co-pays? And then the third, which a lot of people don't understand and realize, is the size of the provider network. How many doctors are in that network? How many hospitals are in that network? And the reason why the size of the network has a big factor in the premium, what the insurance companies do, what the carriers do, is they go out to the providers, they go out to the doctors and the hospitals, and they have a schedule of fees. It's called the reimbursement rate. What is the insurance company paying the doctor for that test, that visit? There's thousands of fees that are negotiated. So a carrier that has a smaller, more localized network is providing a lower schedule of reimbursement rates. So fewer doctors agree to go on the network. A larger, more regional, nationwide carrier with a larger network, to get that bigger network, they have to pay the doctors and hospitals more money. So the insurance company is passing that savings on to you if they have a smaller network, or they're sharing that cost for a larger network with you. Now in this case, small landscape company, 3 employees, they were on a carrier that had a large regional network. Their employees were more on the younger side, lived locally. What we did was we got a list of their doctors and we checked carrier networks with their doctors. The challenge here was this gentleman's health insurance plan was going up significantly. By moving them to a different carrier with a different plan, we saved that 3-person landscape company $23,000. What can a landscape company do with $23,000? It's a lot of money for that business. Okay, that's $17,000. We also saved the premiums for the employees from going up to $281 per month to $202 per month. It's a savings of $900 a year for the employee. Now what we also did was we worked with those employees and we took a portion of those savings and we helped them get things like disability coverage that they didn't have. Okay? Next slide. So we chose the one plan in this situation, small company, only 3 employees, all providers were in that one network, so we were able to save significant money. Now this is an example, this was an interesting story. When you do plan designs, there are deadlines when things need to get done. This was in December of 2021, I got this phone call. It's a logistics delivery service provider based in Everett, Massachusetts. Kind of a quasi-franchise opportunity. The larger organization requires that the franchise provide health insurance for the employees. The gentleman had just recently purchased into the franchise the previous September. Was in the hospitality space and got laid off and decided to come into the logistics space. And he didn't realize that he was under a time frame to offer health insurance to his employees. If he didn't offer health insurance by the end of the year, he would have lost his franchise. He called me on December 16th at 3 o'clock in the afternoon. I was leaving my last meeting. I was planning on taking the year off, the rest of the year off. The deadline to apply for a plan is December 15th. So I first called my friends at the Connector and I said, can we make this happen? And they said, if you can get the enrollment done in 4 days, yes. I think at the time he had 22 employees. He said to me, Andy, I'm just going to offer this plan. It was a gold level plan with a large regional nationwide carrier. Now I asked him a couple of questions. What are the demographics of your company? What's the hiring going to look like? Logistical delivery service provider. Younger workforce, kind of a transient workforce. When I got back to the office and I did the math, I called them up and I said, you know, that plan you're planning on offering, based off the estimated enrollment, is going to cost you $150,000 a year. So why do you want to offer that? He said, well, I've always worked in the corporate world. I want to offer the best health insurance for my employees. So we had a conversation about a younger demographic, more of a male demographic. I don't want to stereotype here, but males generally don't go to the doctor. Young males generally don't go to the doctor. So we talked about that and said, you know, do you need to offer your employees a plan with a large nationwide network? Why don't we look at a more localized network to save you money? But then I said, you know, you do have a larger workforce. At the time, I think it was 22 employees. He was planning on hiring more. I said, you know, if you do have a situation where one of your employees' doctors is not in this network, we can offer them an opportunity to choose a different plan. We looked at a one-level, silver-level plan with a regional carrier. So we lowered his projected cost of nearly $150,000 down to $63,000 a year. Significant savings. That lowered the employee premium from nearly $500 per month to $158 per month. Ladies and gentlemen, these were hourly employees making like $17 an hour. $500 a month for health insurance is unaffordable for that workforce. What that meant was, let's put that in, we lowered their anticipated weekly cost of $115 down to $37 per week, providing them with excellent coverage. So that's an example of, we chose the one level, larger employer. The demographic of the employee workforce said that we could offer a more localized carrier, which saved these hourly employees significant dollars. And we got, by working with them, we got that enrollment done in 3 days.
And Andy, if they wanted to buy the higher, larger network, they could have, right?
They could have, and that actually came up. Going into the next renewal, one of the employees had come under a cancer diagnosis throughout the year. And their care providers were all in the network, but they were considering seeing a different oncologist. And that employee, upon renewal, decided to buy up to a different carrier so they could see a different oncologist. And that's an example of where the importance of offering a breadth of carriers and coverage is really important. Particularly now, we'll see in the next example, you have a workforce with employees on different ends of the age spectrum. Younger employees may want a more regional, localized network because they don't have an established relationship with their care provider. An older employee, an employee with a family, now has different needs. You're looking at more care providers, so you want to be able to offer additional plans that that employee can make the choice. Next slide. So where would a one carrier, this is where the employer chooses the insurance company, and the employee can choose to buy a silver, gold, or platinum level plan. Those metallic levels determine the monthly cost for the employee or the cost sharing, co-pays, deductibles, co-insurance when they go see someone. So in this example, this is a mental health care provider office in Drake, Massachusetts. The challenge for this employer was they had a wide diverse. They had some counselors and employees in their late 20s. They had others in their late 50s. The challenge there is you have some employees, typically, again, I don't want to stereotype, but this is typically what we see. A younger employee says, I don't have as many healthcare needs. I would rather save money on my monthly premium, and if I go to the doctor, then I'm willing to pay a higher copay, because typically I don't go to the doctor. An employee with different healthcare needs may say, I go to the doctor 4 or 5 times a year, I have all these different tests. I see the value from my life experience in paying more for a monthly premium, knowing that I'm not going to have any costs when I go to the doctor, right? And that's an employee decision. An employee gets to make that decision, i.e. you're giving the employee a choice in their health care. You're not giving them one plan and telling them take it or leave it. So in this example, a diverse demographic of employees. The other thing that was challenging to this employer, she had employees being in Drake. She had employees that lived in Massachusetts with Massachusetts doctors, and some employees that lived in New Hampshire with New Hampshire doctors. At the time this plan was offered, when we put this in place, the one carrier model was the only way we could offer a PPO plan. I'm excited now. Is this the first year on the one level we can do PPOs? Yeah. So because of the wide range in employee demographics and age, because of the need for a network across state lines, we chose the one carrier model. Shaitra had mentioned you choose in the one carrier model, you choose the pizza shop, and you choose to contribute to a pepperoni pizza. Let's say the pepperoni pizza costs $10. Employer contributions 50%, so the employee gets $5 to spend on the pizza, the employer pays $5. But in this case, the employee can go to that pizza shop, and if they choose a cheese pizza that costs $8, the employer's paying $5 towards it, the employee's paying $3. Yeah, thank you. Trying to follow my own math here. So in this case, what the reference plan is the reference plan, in this case, the employer used a one carrier model, they chose the insurance company, and they chose the plan. In this case, if employee 1 enrolled in the reference plan, they paid $312 per month. But the employee could look at other plans that cost as low as $218 per month. At that plan, when they go to the doctor, they pay higher copays, higher deductible, higher co-insurance. They could choose to buy up and spend $567. In that case, they'd have no deductible at the time and pretty much no copays when they went to the doctor. Right? That was the employee's choice. Now, when we work with someone, we ask, what is your employee demographic? What are you currently offering for health insurance? I was going to include another example of a one level. We had a law firm come to us in November of 2022, and they said they had a large regional nationwide carrier, 14 employees. Their premiums were going up 49%. Massive. So we looked at it. We took a collection of 38 doctors from their employees, and we did a network search. And we determined that 33 or 34 of the doctors were in a carrier with a regional network, and that the other doctors were in another carrier's network. So that's an example where we offered a one-level, silver-level plan where the majority of the employees were able to enroll in the reference plan, but the two or three other employees where their doctors weren't, they were able to buy up to another plan where the cost was almost the same, almost relative. What that did for that company, that saved them $98,000 in their annual health insurance premiums, and the employees' premiums went down by about $150 per month. Same level of coverage as the carrier that was going up by 49%. And the reason for that was in the doctor network. Coverage was the same. And that's how much the carrier network affects premiums. So when we talk to an employer, we want to know, what is your age demographic? What does your current plan look like? And if we're going to get down to a level where we start talking about a carrier that has a more localized network, we want to look at who are the doctors. And it may make sense to go with that, but that's where we might offer a one-level plan. If we start looking at all doctors are in the same carrier network, that's where we might look at a one carrier, diverse workforce demographic, lower premiums, higher copays, typically a younger worker is willing to take that, higher premium, lower copays, typically a more established, a family, an older employee wants that type of a plan. That is what goes into the choice in offering your health insurance. And the benefit of using the connector is you can give your employees that choice. Additionally, depending on the size, and Chaitra is going to talk to you about this next, depending on your company makeup, you may qualify for the Connect Well rebate, which is a 15% rebate off the company paid premiums. I think that rebate for the landscape company, they didn't actually take it. They didn't follow through with what was needed, but I think it would have been like $3,000 or $4,000.
Thanks for that lead-in, Andy, and thank you for the real-life examples. I don't particularly have those, unfortunately, because I'm more on like, how does it work? What are the benefits and stuff? But, you know, our brokers, they work directly with you, so they hear these actual stories and, you know, they come up with the resolution, so we're happy to have them. Let's talk about this Connect Well. So this is an exclusive option through the Health Connector for Business also. I love saying the word exclusive. So you can only find this wellness rebate at the Health Connector for Business. And what it is it's designed for employers who have 25 or fewer employees enrolled on the Health Connector for Business. Now, the Health Connector for Business is designed for employers who have 50 or fewer, but the Connect Well is a wellness incentivized rebate program that is very focused on businesses that have smaller groups of employees enrolled, so 25 or fewer. And what it does is give you, the business, an opportunity to be incentivized monetarily for offering health insurance to your employees and promoting wellness in the workplace. And the way we do that is we offer a 15% rebate back to the business on what they contributed into their employees' health insurance premiums if they can advise their employees to participate in one of our wellness activities. We have over 30 pre-approved wellness activities, so it's very easy to do one of them and get approved. Employees are incentivized also. They get a $100 Visa gift card for completing an activity and getting approved for it. Let's say this. So Andy just said, unfortunately, his group did not take advantage of this Connect Well rebate, and so they probably lost out on a couple of $1,000s. We don't want to see that happen at all for your business, so we do our best to make sure that we assist you in getting this information out to your employees about the wellness program. So you don't have to ask to be enrolled. If your business is eligible for the Connect Well program, we auto-enroll you. So you don't have to go, I want to be part of the wellness program. We enroll you in Connect Well. Then, every other month, we will email the employees and let them know that they should complete one of these activities so they could get a $100 Visa gift card. We also will email you and let you know what percentage you're at. Are you below the 33%? Have you hit the 33% and you're going to get a rebate at the end of the year? We keep you updated every other month. And if you have a broker assisting you, we also update the broker to let them know where you're at, so maybe they can remind you or the employees to take advantage of this Connect Well program. Once the employees complete the activity, they upload it online. By the way, everything on the Health Connector for Business is online, so there's no paperwork. You don't have to collect anything. And then, once it's approved, we email them their $100 Visa gift card. Our hopes are they start talking to each other. I just got a $100 Visa gift card. And then someone else says, I want one, and they go and do their wellness activity. Once you've reached the 33% participation, we let you know your group has hit 33% participation. At the end of your benefit year, expect to receive some correspondence from us on receiving your wellness rebate. And I just want to let you know, your rebate is money. We hand you a check. So it's not off next year, a discount, not discounted back. We actually send you a check for the amount of up to 15% of what your business put into the premiums for your employees. And so this is a real life, big Publishers Clearinghouse check. And we brought these out prior to going remote in the pandemic. And I love this quote. This is like one of my favorite quotes from this business owner of Clean Properties. And she said, we heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. So we were really, really excited to bring her this check. And we brought her a small check too, so she could cash it. But this was one of the best visits. We did a couple of visits, but this one, we remember her very clearly. All right, so that's one way of getting money back for offering health insurance. There is another way of getting money back that you might possibly be eligible for, and it's the Small Business Healthcare Tax Credit. I want to let you know that I don't talk too in depth about this because I'm not a tax professional. I don't do taxes. But I want to let you know that this is a federal tax credit that can only possibly be acquired by employers who offer health insurance on a state small business marketplace. So the Health Connector for Business is Massachusetts State's small business health insurance marketplace. So right there, that requirement has been fulfilled. That requirement now allows you at tax time to speak to your tax professional and say, hey, I offered health insurance on the Health Connector for Business. Is my group eligible to receive back up to 15% of a tax credit? And then your tax professional will look at some other things that I'm not looking at. Average wages, do you have 25 or fewer full-time equivalent employees? Did you cover 50% or less? They have this whole little calculator that they do. And maybe your group might be eligible for the Small Business Healthcare Tax Credit. But the key to the conversation that you can open it is by offering it on the state's health insurance marketplace, and the Health Connector for Business is Massachusetts State's health insurance marketplace. So that's as in-depth as I go on that one. But don't forget it if you do offer health insurance on the Health Connector for Business to ask at tax time. So now I'm hoping that you just love what Andy and I spoke about today, and now you're like, how do I go ahead and get started? Well, it's pretty easy. I said it's completely online. The first thing you could do is just come to our website, check it out, www.mahealthconnector.org/business. Very easy. And then, I think, Andy, you mentioned there's a few deadlines. So, what's great about small businesses is you can offer health insurance on the first of any month. So you don't have like a calendar year where you have to start it on January 1st, or there might have been a traditional April 1st at some point. You're not locked into that. You can start your health insurance on the first of any month. But the month prior on the Health Connector for Business, you do have to hit a few deadlines. So, for instance, we've passed the deadline, unfortunately, yesterday, a couple of days ago for March 1st. But let's say you're looking for April 1st coverage. In March, you're going to want to offer your health insurance on the website by the 10th. And when I say on the website, you have your own portal, everything's done through there. Again, you're not handing out paper at all. You're just shooting it through a system. It notifies the employees. And then by the 20th of that prior month, the employees have to make their accounts and choose their enrollment through their account. Very easy. It makes it very easy for them to shop, to look at their doctors, to look at formularies, to compare out-of-pocket costs. They have a very easy shopping experience. And then the first payment's due the 23rd, and then seamlessly, all your employees' health insurance plans start on the 1st of that month. And you can do that on the first of any month, and you have a renewing date that is your anniversary date. So if you start on April 1st, you renew on April 1st. If you start on July 1st, you renew on July 1st. You get a full benefit year. We have actually over 500 certified brokers. And again, I just want to notate these are independent brokers. They're not our brokers in particular. They're in your neighborhood. They are available for you. What they do is they offer their services for free on any Health Connector for Business related item for health and dental. A broker, this is their subject matter expertise. If you do not want to put your time and effort into finding the benefit or shopping around or really like doing these cost comparisons and seeing how much you can save and what makes sense, hire a broker. You can easily do it right in the account. There's a tab, it says find a broker, you find one, and then they will assist you, and they will do all the hard work. They will do the quoting. They will explain to you what you're saving, what you're getting, what your employees will have access to. They also have access to your account once you make them the broker, so they can administratively also help you in case you don't really have time to put rosters in or, or set up the benefit package yourself. I do want to let you know that this is a very easy self-service model, and if this is something that you like to do, shop for benefits, you can also do it yourself. Just want to let you know. So, now, we're going to open it up to questions, and either Andy or myself can definitely answer any of your questions. It's your floor now.